Hi, I'm Dr. Chris Good. I'm a spine surgeon and the president of the Virginia Spine Institute. Our field has seen tremendous advancements over the last 20 years, and I'd really like to talk a little bit about motion preservation, or what we call disc replacements in the spine. The spine is a series of bones and discs stacked one on top of another from the base of our head all the way down to our pelvis, and they're all meant to move in relation to each other, just like cars on a roller coaster. And the reality is, as we age and we get degeneration of some of those joints, we can get problems at our discs, we can get pinched nerves. And historically, some of those problems have required surgeons to go in and do what's called a fusion. And a fusion is a process where we actually weld two bones together. So that's very helpful for lots of people, but the downside of a fusion is where there was meant to be motion there, we now eliminate the motion at that one spot. Now, our bodies are inherently supposed to move. Motion is good for our bodies, and if we lose motion in one area, it can change the way our bodies function. Also, if we lose motion in one area of our spine or our body, it can then cause more rapid problems in another area. We've all heard the old song, the thigh bone's connected to the knee bone, and we all know people who get a hip problem and then they end up getting a knee problem because they're not walking right. And so the field of motion preservation and disc replacement is allowing us to start to treat some of these problems with a new type of surgery that takes care of the problem but maintains the motion. So instead of going in and fusing two bones together, we're able to go in and actually do a disc replacement, which is a moving device that takes care of the problem, but it maintains motion there, much like someone who might get a knee replacement or a hip replacement. And if we think about it, if we were to take your knee joint and fuse those bones together, well, now you're walking on a stiff leg. And not only does that change your function, but then that can actually cause problems with your hip or with your ankle and more things down the road. And so by being able to go in and replace the knee and keep it moving, we get better function for a person, but we also can help to try and prevent problems at the next joint down the road. And so with disc replacements, we go in, we replace a disc, we can take care of that problem, but because it continues to move, we can try and help to avoid the problem of putting more rapid stress on one of the discs that's its neighbor. We all know people who had to have some type of procedure and then down the road another procedure, patient who had to have a fusion and then maybe down the road another fusion and another fusion. And the challenge in spine is we're dealing with lots of different joints, lots of different discs all interacting together. And so even if you fix one level, that doesn't prevent you from getting another problem down the road. Another reality of our lives is a lot of spine problems that we get, they're based on our genetics as well as wear and tear. And so some of us have inherited spines from our parents that are just predetermined to have one issue after another down the road. And so treating a problem affecting all the discs surgically can be an issue. If you were to get one gray hair and pluck it out, well, you don't have gray hair anymore, but that doesn't prevent the next one from going in and the next one from growing in. And so being able to take care of patients with disc replacement can be a better way to preserve their motion now, but also hopefully to prevent or delay another problem from coming up down the road.